Circulation in the lower extremities of adults over 60 is fundamentally a problem of pump efficiency and vessel patency. When we speak about boosting circulation in the feet and legs, we are not just talking about comfort. We are talking about the delivery of oxygenated blood to muscle tissue, skin, and nerves that are currently operating in a state of chronic hypoxia. As the vascular system ages, the endothelium, the microscopic lining of your arteries, accumulates damage from systemic inflammation and oxidative stress. This leads to arterial stiffening and the narrowing of the lumen, which forces the heart to work harder to push blood against gravity. If this blood flow remains sluggish, metabolic waste products build up in the tissues, leading to the coldness, cramping, and numbness that so many seniors accept as inevitable. To reverse this, we must provide the specific micronutrients that restore the structural integrity of the vessels and the biological signaling required for vasodilation. The first critical intervention is vitamin B3, specifically in the form of niacin. Niacin acts as a potent vasodilator, meaning it has the direct biological capacity to relax the smooth muscles surrounding the small capillaries and peripheral arteries. When you consume niacin, it triggers the release of prostaglandins, which are signaling molecules that encourage the blood vessels to expand. This expansion increases the diameter of the vessel, instantly allowing a greater volume of blood to flow through to the feet and ankles. For an older adult, this is the difference between a limb that feels starved of blood and one that is properly perfused. It is vital to note that this effect is dose-dependent, and the physiological goal is to maintain consistent levels that support vascular tone rather than causing the sudden, uncomfortable flush associated with megadosing. By integrating niacin into your metabolic routine, you are effectively giving your capillaries the chemical command to open up and allow flow. The second essential nutrient for lower limb health is vitamin C. While it is widely known for immune support, its primary role in vascular health is the maintenance of the tunica intima, the innermost layer of your blood vessels. Vitamin C is the fundamental cofactor for collagen synthesis. Collagen is the structural protein that gives your veins and arteries their elasticity. As we age, collagen production naturally declines, causing the vessel walls to become brittle, thin, and prone to micro-tearing. These microtears serve as catch points for cholesterol and inflammatory debris, which then harden into plaque, further restricting circulation. By ensuring adequate vitamin C intake, you provide your body with the raw materials needed to repair these vessel walls and keep them flexible. A flexible artery can expand and contract in response to blood pressure fluctuations, which is critical for moving blood down into the feet and back up toward the heart. Without this structural support, your vessels lose their ability to handle the pressure of the circulatory system, leading to venous pooling and the associated swelling in the feet and ankles. The third essential nutrient for optimizing peripheral circulation is vitamin D3. In the aging cardiovascular system, vitamin D deficiency is a primary driver of peripheral arterial disease. It is not merely a vitamin, it functions as a powerful corticosteroid hormone that regulates the function of vascular endothelial cells and inhibits the excessive proliferation of smooth muscle cells within the arterial walls. When vitamin D levels are inadequate, the body's renin-angiotensin-aldosterone system, the hormonal pathway that controls blood pressure and fluid balance, becomes overactive, leading to chronic vasoconstriction. This constriction restricts blood flow to the lower limbs, keeping them in a state of oxygen deprivation. By correcting a vitamin D deficiency, you suppress this overactive hormonal response and improve the nitric oxide-mediated dilation of your blood vessels. Clinical research consistently shows that older adults with higher serum vitamin D levels exhibit significantly better flow-mediated dilation in their lower extremities, proving that this nutrient is a non-negotiable requirement for restoring the highway that blood travels through to reach your feet. The fourth vital nutrient is vitamin K2, specifically in the form of menaquinone 7. This nutrient serves as the essential traffic cop for calcium within the cardiovascular system. As we age, calcium frequently migrates away from the bones, where it provides structural support, and settles into the soft tissues, specifically the medial layer of the arterial walls. This process, known as vascular calcification, turns your arteries from flexible, elastic tubes into rigid, non-compliant pipes that cannot expand to accommodate increased blood flow. When your arteries are calcified, the heart must exert significantly more pressure to move blood down to the legs, and the vessels lose the ability to pulse. Vitamin K2 activates a specific protein called matrix GLA protein, which acts as a potent inhibitor of calcification. By ensuring the activation of this protein, vitamin K2 effectively prevents calcium from depositing in the arterial walls and directs it back into the skeletal matrix. This restoration of arterial compliance allows your blood vessels to regain their natural elasticity, permitting blood to move freely into the lower extremities even against the force of gravity. Without K2, no amount of exercise or other interventions can fully restore the structural integrity of your circulation because the physical hardening of the vessels remains unaddressed. This is a structural solution to a structural problem, ensuring your circulatory system remains a dynamic, responsive network rather than a static and brittle set of pipes. The fifth vital nutrient is vitamin E, a collection of fat-soluble antioxidants that play a critical role in blood rheology, which refers to the flow characteristics of your blood. In older adults, blood viscosity often increases, making the fluid thicker and more prone to stagnation within the smaller vessels of the legs and feet. Vitamin E acts as a natural anticoagulant by inhibiting excessive platelet aggregation. When platelets become too sticky, they form microclots that can impede flow in peripheral arteries. Vitamin E prevents these platelets from adhering to the vessel walls and to each other, ensuring that the blood remains thin enough to penetrate the distal capillary beds of your extremities. Furthermore, it protects the cell membranes of your red blood cells from oxidative damage, allowing them to remain deformable. Deformability is crucial because red blood cells must physically change shape to squeeze through the narrowest capillaries in your feet. If they become rigid due to oxidative stress, they create a bottleneck that halts circulation. Vitamin E provides the protective layer that preserves this flexibility, ensuring that oxygen is successfully delivered to the farthest tissues of the lower limbs, effectively reversing the stagnation that causes coldness and localized numbness. The sixth and final component is the vitamin B complex, specifically vitamin B12, B6, and folate, which act as a tripartite defense against homocysteine. Homocysteine is an amino acid byproduct that, when elevated, acts as a direct toxin to the vascular endothelium. It essentially acts like an abrasive, scratching the inside lining of your arteries and veins, which triggers an inflammatory response and leads to the formation of plaque and the thickening of the vessel walls. Many seniors suffer from impaired absorption of these vitamins due to reduced stomach acid, leading to a silent buildup of homocysteine that wreaks havoc on peripheral circulation. By supplementing with the methylated forms of B12, B6, and folate, you neutralize this compound, effectively stopping the chemical scratching that degrades your vessels. This preserves the smoothness of the vascular lining, allowing for streamlined, frictionless blood flow. When your vessels are free from this chemical irritation, they can maintain their diameter and function efficiently, preventing the vascular deterioration that leads to the complex circulation issues often misdiagnosed as just aging. Implementing this protocol requires a long-term perspective. These 6 vitamins, niacin, C, D3, K2, E, and the B complex, do not function as temporary fixes but as foundational elements that rebuild the architecture of your circulatory system from the inside out. They work in synergy. Vitamin C and K2 manage the structural integrity of the walls, D3 and B complex manage the hormonal and chemical environment, and niacin and vitamin E manage the fluid dynamics of the blood itself. Together, they create an internal environment where your blood vessels are capable of expanding, contracting, and transporting oxygen without the structural impediments that limit circulation in the aging body. However, you must be disciplined in how you integrate these. This is not about taking a handful of pills once. It is about consistent, daily physiological support. Because these nutrients are processed through different pathways, you should focus on sourcing them from high-quality whole foods or professional-grade supplementation, ensuring that your body is not struggling to absorb them. Before making these additions, it is imperative that you consult with your primary healthcare provider, especially if you are currently taking blood-thinning medications or heart medications, as some of these nutrients can interact with pharmaceutical prescriptions. Once you have established a safe, consistent routine, you are no longer relying on external interventions to force circulation. You are empowering your body to facilitate its own blood flow. This is the difference between a body that is fighting its own structural degradation and a body that is actively maintaining its own vascular health. By providing these 6 specific building blocks, you clear the pathway for your heart to efficiently nourish every cell in your legs and feet, ensuring that your mobility remains intact and your circulatory system remains a robust, life-sustaining network for years to come. Your longevity depends on the health of your vessels, and by taking these steps,